is Jessica, and I'm here because I want my patients to have a safe hospital. I was born at this hospital 28 years ago, and I know it's a great hospital. It supports minorities, and I have a bunch of patients who are homeless, who we never hear from again because they don't have resources to come back to us.
Yeah, Clinton. I'm a nurse in the emergency room. Well, they have no staffing, they have no testing in place for the staff here. So when you have co-workers that are possibly having exposure, you can't get tested from employee health. So they send them to resources out in the community to be tested for COVID. I think that those resources in the community should be used for the community, not for a $1 billion health system. And the fact that that's where they send their employees to be tested is a disgrace. And it's a slap in the face to the community.
In the middle of a pandemic, they're not properly testing people here at the hospital?
No, they're not. And the few testing that they do have in place, they set the bar so high to be tested that no one can be tested. And when you do that, you're not only exposing the people who work here, but you're exposing the patients as well. And that needs to stop. We're 8-9 months in the middle of a pandemic, and you have nothing in place in regards to testing of your employees. I think people are being treated this way because of green. This has nothing to do with black, brown, white, or black. It has to do with green.
My name is Trent Willis. I'm the president of the International Longshore and Warehouse Union Local 10. I'm out here representing two different entities. First, the ILW Local 10, of course, and then I'm out here representing the Committee to Stop Police Terror, End Systemic Racism, and Stop Privatization. And we're out here solely just to support our fellow union workers, our fellow workers, and we're out here to support our sister local, Local 6. The ILW says that give these workers a contract now, give them PPEs now. There's no reason for the delay in their contract. They should have a contract, fair wages, safe working conditions, and everything that workers deserve in this country, these workers should have. And any workers that are disenfranchised or the employers refuse to treat them like human beings, the ILW is going to support those workers. Okay? Fair wages now, safe working conditions now, contract now.
No justice, no peace.
No justice, no peace.
That means we need
everything that we need. Everything that's fair for us.
By injustice, what's going on here that's injustice?
What's injustice? It's like they want to take our medical, they want to take all our privilege away from being a part-time and full-time employee. Okay, they want to take our differential away from us. That's all I got to say.
I do EVS housekeeping. Yes.
Have they been contracting out your work to other people?
Yes.
What's that like?
You come in as a contractor, you work, and if they pick you, they pick you. If they don't, they don't.
I'm here today for my patients. I am not here because I want a raise. I'm here for my patients today. Management is not hiring staff. We're bringing temps in. We have a bunch of people who have been working with us for years, and they still don't have a full-time position. So they're bringing temps in, and that's what we're fighting for today. We don't want any more temps. We want them to hire people who have been here for a long time and know what they're doing.
For equal rights for all of our coworkers.
Contract, understaff, taking our benefits away.
Yeah, we're tired of being abused, especially during these times. So we're for the people, but we got to be safe too.
Amy Hamilton, we want public health in public hands right now.
Amy Hamilton.
It's been taken over by AHS management. It's been mismanaged, misfunded. We're ready for action. We want to be taken over. Our patients deserve safe situations in the hospital with their nursing, their whole health care. They deserve our doctors and our providers to not get laid off. Sorry about that. There should be no layoffs. We are in a pandemic. This is a time that we need our providers, nursing, doctors, everyone. It's not fair to employees. It's not fair to the community.
In the middle of a pandemic, why haven't they had proper staffing? You'd think that that would be the time to increase the staffing.
I agree. And we have travelers that aren't a part of our system, and they're traveling all over, and we deserve to have safe patient ratios.
What is it like working in a hospital in the middle of a pandemic without proper staffing?
It's scary. It's stressful. It's taken a toll on a lot of us. You can just tell, like, with the mental health, the morale, it's definitely defeating, and we're ready for action to be taken to help protect us and help us feel comfortable and be in a safe working environment.
And the Alameda Board of Supervisors, where do they stand on this?
They're with us. The county is ready to take us to help us, and we're ready for that action to be taken.
My name is Diva Wolf. That's DEVAWOLF. I work with Amy here on the Family Birthing Center. I'm a RN, and we are out here because this is our community, and we support and serve the most vulnerable populations out here. We deserve better care for all of them. We've been understaffed, we've been underfunded, we've been under-resourced, we've been going to our management, we've been going to the Board of Trustees, we have been going to the Board of Supervisors for years. The system's been broken, and it's time to make some real change. We're dealing with a lot of health disparities in Oakland. We all know that brown and black people are suffering more from this pandemic. We know there's health disparities in birth, and we want to address it. But we need resources, we need funding, and we need people to not be trying to run this thing like a business, okay? This is gonna take investment, this is gonna take a true commitment, and we're ready for the Board of Supervisors to get behind this, to really bring some structural change.
You think this is part of contracting out, outsourcing, privatization? What's going on here, outsourcing jobs and things like that?
We do have a lot of travelers. That's kind of part of the healthcare system. You know, our people in dietary have been really mistreated by the outsourcing there, a private contractor. We don't need that. We don't need to be spending money on private contractors. We need to really focus on the priorities here. And you need to listen to the employees who work here. We've got a pretty good idea of what's going on, and there's a lot of talent, there's a lot of inspiration, and a lot of passion, a lot of people putting in a lot of hours on their off time to help solve these problems.
And how have your patients been affected, you know, and the babies that you're delivering?
You know, I have to say that I think the people who work here, we work with all our heart. We're used to working under low resources, and I do think that we could do better, but
You think it's part of systemic racism, the way people are treated?
Yeah, absolutely. We're dealing with people whose lives have been affected by racism since they were born, and you know, they get in here, and honestly, we need to be thinking about what are the true ways to help people to kind of close these gaps of health disparity. We want people to feel comfortable here. Our motto is that we serve all, we need to represent all, and we need to invest in the programs that the people of this community have found to reduce these health disparities. I'm talking things like something that was just started on our unit, which is called Black Prenatal Centering. It's a beloved program where people can be together, they can support each other, they can build community through their prenatal care. But honestly, we need more time with our patients. Our midwife's appointments are only 15 minutes. It's just not nearly enough to cover the wide range of health issues in one 15-minute visit. We need our patients to be able to easily call the call center and change or switch an appointment. There's some basic things that are broken here that are very frustrating, not only for the employees, but for the public.
And the managers, these managers that they have in AHS, who are they?
I'm not going to name names. It's not really about that. It's about the bigger issues of the structure. It's about really focusing on the future and how we can do things better and different. And we'll let the Board of Supervisors, the County Board of Supervisors, deal with the upper management.
And pandemic, we've been in a pandemic for months, over a year now.
Yeah.
Why isn't the healthcare system prepared for that?
Yeah, that's a great question. I think it'd be better for the managers. I can't really answer why they didn't do their jobs and get it together for this. But I'll tell you some examples. I want to bring up the, let's get out of the street a little bit. I want to bring up what's going on in the healthcare in the clinics, okay? So you have people who work in the clinics who are getting 1 mask per week. And then we have management telling us that there is no problem with PPE. So if there's no problem with PPE, give us a mask every day at least, okay? 1 mask a week is insufficient. These people are risking their lives coming to work every day, and we're not getting COVID tested on a regular basis. We're only getting tested if we're symptomatic, when the whole world knows that asymptomatic people can spread it. We need regular testing to be sure that the employees who are serving the community are staying safe. If we're not safe, our community is not safe. It's all about priorities.
Think it's about profits?
Absolutely. This is trying to be run like a business, and every time there's a problem, we hear there's no money in the budget for that.
Those things are things that we're fighting for out here in the street today. Even worse, right now I can tell you I'm an ER nurse and I've had to do this over and over. We send patients out into the streets in the middle of the night with paper scrubs and in socks. That's not okay. AHS is required by the state law to provide those things, and they don't even have a plan to do it. That's not acceptable for our patients. It's not acceptable for us.
I work in the food nutrition in the cafeteria. I see mostly every day. I'm an SAN worker, and I work crazy hours. And I put in for a conversion. They say I couldn't get a conversion because you have to work so many weeks, 16 weeks or something like that. And I know for a fact that I didn't exceed that. For a fact. Anytime that I do 6:30 in the morning to 6, 7 o'clock at night, I want a position. I want insurance. I want all that. So therefore, am I for this? Yeah, I'm for it.
My name is Francesca. I'm here with my pharmacy family. Yes. We're so happy to see everybody out here supporting each other. So what's going on in the pharmacy department besides the budget cuts, cutting staffing? They're adding more tasks to each individual worker, and that creates an unsafe environment for our patients. That's not fair to our patients. We want to take better care of them. So we're asking for a fair contract, a safer environment for our patients. Thank you.
For a fair contract and for management to stop treating us like children. They harass us. They constantly add jobs to our jobs that we're already understaffed for. Going on 5 years. I'm in the cafeteria. I'm the catering coordinator.
Why do they do that? Why do they harass you?
Because they have nothing better to do with their time and they don't know how to do their own jobs. My name is Isaac.
Do you think this company, AHS, should be running the facility?
Absolutely not. They have done nothing but destroy the hospital and the hospital's good name.
And why is that? Are they doing it for profit? Or
so they can get bigger salaries. Their salaries are going up, ours are going down, and we're losing workers.
And contracting out, has that affected you?
They're getting other people to come in here and do the jobs that they hired us to do so they can move us out.
What about seniority?
They don't believe in it, apparently.
I'm a nurse. SEIU. Safe conditions for our patients. Yeah. They just keep taking things away from the nurses and the other staff, and it's just not going to be safe for our patients. That's why I'm here.
What about PPE? Have you had a problem getting PPE?
So far, we're mostly okay, but they keep threatening that we're going to run out any minute. So we're on the edge all the time. And they cut back on testing so much that we're never sure if we're even wearing the right PPE because the patients aren't getting tested. So that's the concern.
This is 6 months of the pandemic and the patients at the hospital still are not being tested regularly?
Not regularly, no. Yeah, it's very concerning. So we've had exposures in the ICU. And yeah, we're just out of patience for it. You'd think it would be a couple months maybe they could ramp everything up and get it to us, but no, we're still here, still with COVID patients. And the Board of Supervisors should be the ones kind of controlling what negotiations go on with the hospital and getting us funding. And since it's been pushed off to this Board of Trustees, they're not dealing with our union effectively to get us what we need. So we really need the elected Board of Supervisors who are elected by their constituents to take over and get us funding for the county hospital like it should be.
We all in agreement. I'm never running from a challenge, never been sheepish. In the rap, all the thing we got to get me in. You got to see me do my thing, son, I'm too fiendish. Flinging tune after tune till the wound deepen. I have a room of human beings feeling woozy like a fiend leading. Moving to the music in a fever screaming, baby.